A St. Joseph's COVID care clinic that opened just over a year ago in October 2021 is celebrating a milestone. The first clinic of its kind in the country to treat high-risk patients who've come down with COVID-19 has now provided more than 3,200 treatments to patients all across Ontario. Manisa Danabalan has that story.
The first clinic offering treatment for those at high risk of serious outcomes from a COVID-19 infection, and it was right here in Hamilton. What started off as a pilot project treating 15 patients a day progressed to about 30 to 40 patients a day. Dr. Zain Chagla from St. Joseph's Hamilton, who spearheaded the team, says being the first clinic came with challenges.
We had to deal with documentation and like how we consent people, how we get the drug in, how we recruit people. At the time, we still need people to have a positive test, but how do we convey to people that that this drug is available, that it's not experimental, and really do that education for patients in that sense.
The model was used to build 7 more clinics across the province. As the COVID-19 pandemic changed with new variants, so did the treatments at the clinic. Back in October 2021, it started offering monoclonal antibody therapy, but now offers remdesivir and paxlovid.
Monoclonal antibodies for treatment we stopped in April because, again, the data suggested they didn't work against current variants. We are giving a little bit of Paxlovid. Now Paxlovid is widely available through primary care, through pharmacies, so we're not seeing as much demand for that. And so really, the vast majority of what we're doing is remdesivir, given the skilled nursing and the ability to do it on site.
Mary Smith from Guelph has high blood pressure, and she was a patient at the clinic who received Paxlovid when she got COVID-19 just a few months ago in July.
I was sick for about a month, but I was just really very sick for 3 days, and the Paxlovid really helped. I took it for 5 days, and I felt better within 2 days. On the second dose of the Paxlovid, I was starting to feel better.
She's grateful for the clinic and the treatment she received.
I just knew I was in good hands, number one, and everyone was just so nice. And I saw other patients being treated there in an ante room, I think.
Chagla says it started off as a vision, and now the models have expanded around the province and country.
Chagla added that in less than a year, we moved from a 1% mortality rate from COVID-19 to less than a 0.1% mortality rate because of vaccines and treatments.